every month we have what we call the Good Catch Award, where any one of our employees might detect something, might sense something doesn't look right, seems out of place, and they're concerned about safety for our patients or a visitor, or it could be a colleague as well. And so both of these individuals actually received that Good Catch Award, but it was so impactful and meaningful to the organization, and you'll hear quickly the people that it affected, that we had a tie this year for the Safety Hero of the Year. Our panel reviewed each monthly Good Catch Award recipient from 2022 and scored them across 4 criteria. 1, the scope of the problem that they intervened on. 2, the severity of the problem that was intervened on. 3, the impact to the organization, to Kaweah Health. And lastly, the degree of action that was taken. So I'd first like to recognize Brian Hernandez Armenta. So Brian actually is an emergency department mental health worker, but at the time that he made his good catch, all the way back at the beginning of the fiscal year, in July of 2022, Brian was a patient access registrar. So having knowledge and awareness of stroke-like symptoms is something all staff can do to help prevent long-term disability or even death for stroke victims. Brian Hernandez Armenta, who was a patient access registrar at the time, was working in the registration areas of the Kaweah Wing lobby when he took note of something that a patient was experiencing. He saw an abnormal symptom in the patient's face and immediately thought about be fast, balance, eyes, facial drooping, arm weakness, speech difficulty, and time. Having knowledge of this acronym used by the American Heart Association as a way to detect a stroke led Brian to take immediate action. He first decided to take a closer look at the patient and noted that the left side of this patient's face was drooping. He then spoke to the patient and noted that his speech did not sound right when he spoke. He knew that these symptoms could indicate that a stroke might be developing. He also understood that the time factor was important to the patient's diagnosis and treatment. Brian hurried to find clinical staff in the emergency department that could take a closer look at the patient. The registration staff helped take the patient to the registered nurse and the physician triage area. Brian was correct. The patient became a stroke alert and was immediately taken in for a workup, followed by treatment. We are very grateful for Brian's watchful eye during this busy time in the ED. Brian made a difference in this patient's life because he did not hesitate to speak up for patient safety. Well, Wendy was our Good Catch Award winner back in August of 2022, and a very similar story as Brian's. Wendy Rodriguez Hernandez, security officer, was busy working at the entrance of the emergency department. She suddenly saw a patient who seemed to be having stroke-like symptoms. She immediately found a registered nurse, told her what she had observed, and asked her to assess this patient urgently. Because of her quick action, Wendy prevented delaying care for this patient. Because of Wendy's actions, no time was lost in assessing this patient and working them up for what resulted in a confirmed stroke. Had Wendy not been so observant, the patient most likely would have spent extra time waiting, which would have delayed the care they received. Wendy is directly responsible for the positive outcome this patient experienced. Thank you, Wendy, for your role in keeping our patients safe.